My name's Dr. Andrew Flint. I practice around the state of Connecticut in various small animal practices. What convinced me to do the CPAP procedure is a rather interesting story. I knew some equine veterinarians who did stem cell therapy, and I was interested in learning stem cell, and I knew that there was quite a bit of an expense with it, but it did work. And I asked them if they were using the stem cell therapy, and they said they actually have a number of other things that they use other than the stem cell, one being the CPAP procedure from Paul Corporation. And one of the veterinarians I know, she gave me the packet that gets sent to the equine vets, and I called one of the marketing directors, I believe he was in Florida, and he put me in touch with Dr. Schaefer, and he and I had a conversation. I said, I have some dogs that might be able to benefit from this. I was wondering if it could help with canine arthritis, and that's what brought me to it. And all I can say is, so far, with all the dogs I've done, I've just been amazed by the results. My primary goal is to make sure that my patients are happy and comfortable, and I can provide as many years of companionship as possible for my owners and their pets. So that's really the biggest thing. One of the advantages of CPET over other therapies is the convenience. You can do it right in your clinic. You could even book it during a regular appointment slot. I would say a 40-minute appointment slot where the owner would drop the dog off in the morning, but you can schedule it right in during your regular office hours. You can put it in during your surgery time. It's just the convenience of doing it right in your office and not having to worry about having a lot of equipment around. There is basically no equipment to invest in. With the dogs that I have used the CPET procedure on, they have had any number of other treatment modalities performed on them, whether it be acupuncture, chiropractic, NSAIDs, laser therapy, having precursors to joint fluid injections, and all these things. I now have the CPET to use as well. I'm a certified chiropractor and an acupuncturist, so I believe in both Western medicine and Eastern medicine, and this is an approach where we're using the body to help itself.
I'm Harlan Gotthelf. I'm a veterinarian at Syosset Animal Hospital on Long Island. CPET has offered our practice a new modality of treatment for animals with joint disease and arthritis. It has offered a treatment option beyond anti-inflammatories, beyond supplements, that it's a new age technology and a cutting edge technology of ways to treat animals with joint disease. It is a modality, a treatment option that is, as far as regenerative cell therapy, it's a very easy easy treatment option and an inexpensive treatment option for the animals and for the owners. This is a homeopathic option for that patient. We're using the pet's own cells, so we don't have to worry about side effects from the platelet therapy. It takes the treatment a step further beyond medication, where we are treating the joints locally, and we're hoping to regenerate some cartilage formation, decrease inflammation locally. So there are many factors, but we find that it's often a situation where the animal can only be benefited from it, and there's really no bad side effects to it. The procedure probably takes about 15 minutes overall, and after the procedure's done, we reverse the sedation and the animal's awake and ready to go. I think it is a great treatment modality for us to be able to offer to our pets, our patients. The regenerative cell therapy, I think, is the future of medicine for us. And I think the CPET therapy is a inexpensive, easy treatment option for these pets, and I think it's a great therapy.
What convinced me to start using this platelet enhancement system is I have a lot of patients who have just exhausted the low morbidity procedures. I do a lot of arthroscopy, which is easy on them, and they go home the same day. After that, these patients are looking at more invasive procedures: hip replacement, elbow replacement, something called a sliding humeral osteotomy, where you actually cut the humerus bone. All these things are very invasive and honestly very expensive for a lot of my clients. They just can't do it. So I'm trying to give my patients another alternative that's low morbidity, lower cost, very easy to do in one procedure, and that's what the platelet enhancement therapy offers. I can do the therapy under one sedation and get them back to the clients. The clients are happy, the patients are happy, and at the end, I've done no harm, and I hopefully will help them. What CPET has done for my office is that they've given me the opportunity to offer some new alternatives to my patients, something that is a new philosophy, a new way to approach disease, which is basically what arthritis is. It's been in the human side for over 20 years. It's been shown to be safe, so I'm offering them a safe option and possibly helping them live many more years with pain-free and less drugs. I'm not a big proponent of giving them patients lots of drugs to counter pain. If I can do it in a more natural way, I'm a happier physician and my patients are happier as well. The CPET procedure typically takes 15 minutes, 20 minutes at the top end. It's a very simple, quick procedure. By the time I sedate the dog, I do the blood draw, put it through the filtration system, and re-inject it, it takes about 15, 20 minutes. I have not seen any adverse reactions with the CPET procedure. The only thing I do see is the same thing I'd see with any joint injection, that they might be a little sore the night of the surgery, the procedure, and possibly the next day for about 24 hours. And I will give them some pain medication for that. I usually use either an anti-inflammatory, or if there's a dog that's already been on an anti-inflammatory, I'll give them some other narcotic to take home, like a tramadol, which I find is fairly effective. But they shouldn't need it longer than 24 hours. I also have them ice pack the joints after the therapy for a couple of days to help with any post-injection inflammation that they might have. And that, one, helps the patient, and two, the client feels more proactive on the dog's recovery.
My name is Cindy Latanzio. I'm the owner of Scout, well, myself and my daughter. He's a 12-year-old Australian cattle dog. His arthritis was very progressive. It started out slow, but just got worse and worse and worse. He never wanted to slow down, though. He kept trying to keep up, and the day after he would spend a day at the barn, he would be extremely lame. About a year ago this time, he had gotten so bad that I started to prepare my daughter that I thought maybe by the next winter we might have to euthanize him. Not only had he stopped playing with my other dogs outside, he laid inside and just developed this very dull look in his eyes, like nothing interested him anymore. So we decided to do a kind of all-out treatment on him and see if we could improve him to the point where he would at least enjoy his life a little bit. He had been on a joint supplement, glucosamine and chondroitins, and had been on, we tried a couple of different NSAIDs that the vet had prescribed for him. We also started him on weekly Adequan injections, and I brought him every week to the vet and alternated 1 week acupuncture and the next week chiropractic work. And we also started twice a week and then dropped to once a week, hydrotherapy with a physical therapist who put him on an underwater treadmill and did a lot of physical therapy work with him. We did that for several months, and I would say the improvement was marginal. He maybe looked a little bit better, but certainly not that I thought we were going to extend his life and really take away his pain. Dr. Flint had been treating Scout for some time, and I had all along been expressing my concerns about his quality of life and how low I thought the quality of his life was. And he said that he had learned of CPET and thought that maybe Scout would respond to it. I really didn't have any concerns about getting it done because at that point I thought I had nothing to lose. He's doing great now. He's still an old dog. He has a lot of general stiffness because he has arthritis in his spine and in his hind end and both front legs. So he's not going to run and jump in the air and stuff, but he's back to enjoying life. He goes down to the barn with me now and trots and even does a little running by himself. He's playing with my other dogs. and he has a spark back in his eye, and that's what was gone. It was the dullness in his eye that just broke our hearts. I went in about 2 months later and said, it's a miracle. I just was so thrilled with the difference in my dog. And that's the word I still use today, that I thought I would have to euthanize him last winter. It's now the next summer. He's still going strong, and I don't know, I hope we still have a long time with him.
I'm Marilyn Lazar. My dog is Thumper. He is a pit bull mix. The reason for choosing CPET, I feel it's a more holistic approach to a very common problem, particularly in dogs with their legs. He's got a lot of arthritis. I don't believe in the steroids. I don't do it for myself. I'm have a more holistic approach and homeopathic approach for myself, and I really would prefer not to give my dogs drugs if I don't have to. I did not expect that quick a result. However, it was only 3 days. The procedure was done on a Thursday. Sunday morning, the dog realized he could actually put his foot down and walk on it without much pain, and we walked for 2 miles. He was up at the dog park. He found a dog that he literally 20 minutes worth of kids would be roughhousing. The dogs were roughhousing. He was up on his hind legs, both of them, kind of like a boxer, boxing and playing with this dog and running. I got him home, and I was prepared for the typical limp that I've had over in the past. There was no limp, none whatsoever. And now I don't hesitate to take him. He just seems to be a happier dog. I don't think he's in the pain that he used to be in from the arthritis. And for him to be able to play 20 minutes and no limp, that was huge, absolutely huge. I was thrilled to find that my vet was very accommodating when it came to performing this procedure in her office. And she was very into it. She was very thrilled to see on examination prior to the second treatment that he did have a significant improvement in the range of motion in his right hind leg. I would highly recommend this procedure for anyone during surgery or for this arthritic reasons. I just had such a dramatic effect on it had just such a dramatic effect on my dog.
I'm Jocelyn Oddie, and I'm the owner of O'Malley, who's a 9-year-old American Pit Bull Terrier. I decided to do the CPET procedure because she had originally had both of her ACLs surgically repaired, and that it did, cure most of her symptoms, about 90%, but I could tell that I still could not, continue with her daily activities as far as, ball playing or even just, chasing squirrels off the deck. So I felt like I needed, a little bit more to see that, if it would correct her symptoms. She was shifting her weight back and forth when she was eating her food, so I knew she was in some discomfort. She could not play ball without being completely lame the next day. She would limp and hobble along, and she would look like a much older dog than she really was. She was aging rapidly. I tried other therapies before trying the CPET, which included acupuncture, chiropractic, and anti-inflammatories. My first concern that I had asked my veterinarian was if it was safe for her. I did not want to put her through any major procedure or very invasive procedure because of her sensitivities. I wanted to be sure that it was safe and there were very minimal risks to her. Once the effects of the sedation had worn off, I saw a difference within 6 hours of the procedure. She seemed to be much more comfortable. Significant improvements started pretty much 12 hours after the procedure. She was standing a lot more sound. She was not shifting her weight back and forth, and just her overall movement was much more sound. I would absolutely recommend CPET to a friend, just due to the fact it's, an all-natural approach and a very non-invasive procedure. I can now go about interacting with my dog as if she were a 6-month-old puppy, playing every day and not have to worrying about whether she's in pain or discomfort.